Hello everyone, welcome to our channel MedVeda, where you seek a new learning experience with me. Today our topic is anemia. Before going to know about anemia, remember the structure, function, formation and destruction of RBC, which is physiology part that I already uploaded in our channel. If you gonna check, please go and check. The links are provided in the description. Now come to topic anemia. It is a condition the patient with low RBCs or with low hemoglobin in blood. Here the picture shows clearly the reduction of RBCs compared to normal RBCs in the blood. By performing complete blood count, if we diagnose the patient with hemoglobin levels of less than 13.5 gram per deciliter in male and less than 12 gram per deciliter in female and hematocrit value of less than 39 to 49%, then we term it as anemia. Next, the symptoms associated with anemia are tidiness, dizziness, or feeling lightheaded, headache, shortness of breath, especially when exertion. Indeed, there are many mechanisms to categorize anemia. In that, one which clinically useful to categorize anemia is morphological classification. It is also known as Winthrop's classification. Classification accordingly by alternations in red cell morphology characteristics, which include cell size and hemoglobin concentration, where the cell size in blood volume medically termed mean corpuscular volume, abbreviated as MCV, and hemoglobin concentration as mean corpuscular hemoglobin concentration, abbreviated as MCHC. The average value of MCV is 80 to 100 femtoliter, non-normocytic. If less than 80 femtoliter, called microcytic, that means decrease in RBC size, and if greater than 100 femtoliter, cause increase in RBC size, called macrocytic. If there is average content hemoglobin in cell, then there is no change in color, so normochromic. If hemoglobin is less than average content, then color changes known as hypochromic. Increase in hemoglobin concentration doesn't observe in anemia because anemia means only decrease hemoglobin concentration. Okay? Based on this, the table was created, which is important in RBC pathology, so tries to memorize well. If a patient with microcytic and normochromic, the chronic infection causes, that is, decrease in cell size and no change in hemoglobin. Now decrease in hemoglobin also. That means microcytic and hypochromic causes iron deficiency anemia, thalassemia, which is hemolytic anemia, and sideroblastic anemia. Okay? Next, causation of anemia even though there is no change in size and color, that are acute hemorrhage, hemolytic anemia, except that, and aplastic anemia. Here, the problem in bone marrow. Next, chronic hemorrhage. In this, the cell remains same but decrease in hemoglobin concentration. That means normocytic and hypochromic stage causes chronic hemorrhage. And lost macrocytic. Here, the cell size is large, and if normochromic, it causes megaloblastic anemia, though due to vitamin B12 deficiency and folate deficiency, which helpful in DNA synthesis in RBC. Okay? Finally, liver diseases and also chronic alcohol overuse cause cell to macrocytic and hypochromic. Well, the table was completed. And next classification is etiological classification. It also known as Whitby's classification. It according to cause. Etiology means cause. Okay? Firstly, hemorrhagic. It is due to blood loss and divided into acute blood loss and chronic blood loss. In situations like trauma and accidents, we can see acute blood loss, and in cases like piles, peptic ulcers, and in menstruation of female, by slowly loss of blood, can see chronic blood loss. Next etiology is hemolytic anemia. Means here the hemolytic means RBC destruction. If increase in RBC destruction cause hemolytic anemia, and it divided into intracapsular defect and extracapsular defect. Here in the intracapsular defect refers abnormalities in RBC itself. So the destruction take place and causes hereditary spherocytosis, sickle cell anemia, thalassemia and deficiency of glucose-6-phosphate dehydrogenase. And the cells in extracapsular defect is destructed by external factors like infection or immune mediator. So it causes like malaria and hypersplenism. And final etiology is decrease in RBC production. Here it by dietary deficiencies and by abnormal homeostasis, also known as aplastic anemia. The dietary deficiencies means like iron deficiency, vitamin B12 deficiency and folic acid deficiency, whereas aplastic anemia is caused by cytotoxic drugs, X-rays and gamma rays. Thanking you. For more videos, just stay tuned to our channel MedVeda. Like, share and subscribe. Thank you.